Hello, my name is Tammy Kahn, and I'm the section manager of the Maternal, Child, and Adolescent Health section here at the Nevada Division of Public and Behavioral Health. Thank you for participating in this training, which is intended to assist child welfare, social services, substance use disorder treatment, public health and mental health agencies, hospitals with labor and delivery units, and providers of maternal and child health services to identify services and resources for families impacted by problematic substance use. This training is a part of a series of trainings related to Comprehensive Addiction and Recovery Act, or CARA plans of care. However, it's applicable to anybody who would like to better understand how to navigate the Sober Moms Healthy Babies website, the Nevada Medical Home Portal website, and navigate the Nevada Home Visiting Program and where services are offered. With me today is Cassius Adams, the Children and Youth with Special Healthcare Needs Coordinator, Tasha Cadwallader, the Maternal and Infant Health Program Coordinator, and Ellie Comito, the Nevada Home Visiting Program Manager. Cassius will be giving an overview of the Nevada Medical Home Portal. Tasha will give an overview of the Sober Moms Healthy Babies website, and Ellie will give an overview of the Nevada Home Visiting Program and how to receive those services. This training should help you understand how to find and connect families with CARA plans of care to supportive services in Nevada. So first, to start out with, Cassius will be giving an overview of the Nevada Home Medical Portal. So I will turn it over to you, Cassius.
Thank you, Tammy. So the Medical Home Portal is a resource designed for parents and providers in order to help them guide children and youth with special healthcare needs towards their best outcomes. The Medical Home Portal has a wide variety of resources, like, for instance, this diagnosis and conditions section. You would find a wide variety of conditions with which to research or with which to better understand in your practice. For instance, here we're just going to go ahead to substance use disorders. And here you'll find the basic overview and some assistance with regards to trying to code this stuff for medical billing purposes. But let's say you would like to understand more about who's providing some services here. First thing I want to guide you towards is this drop-down menu, as it says Nationwide Directory. The Medical Home Portal extends beyond the state of Nevada. And so if you're looking for resources in this state specifically, you're going to want to highlight the Nevada directory. After that's done, you navigate to the national and state service directories here. And once you're on this page, here's where you're going to be looking for the information that you need. So you can enter any term here you want. You can enter a specific service category if you're looking for a specific type of treatment. Or depending upon where in Nevada you are, you can enter your zip code and see who's operating in that area. Additionally, you could just come to the alphabetical list here. Say you click on M, and now we're looking at mental health counseling. So if you're interested in, say, substance use disorder care, you can go ahead and click on this link here. And what you'd be presented with would be a list of providers in both northern and southern Nevada. The providers are all going to be located on the left-hand side of the screen, but each one is represented by a little indicator here. So if you had a specific area that you were in or you wanted services, you could just highlight any specific instance here, click on it, and you'd be taken right here for more information. And after you get this box, you can go ahead and call the number. You could reach out by email, but you would otherwise be in the position to receive the information you need on the care that you're looking for. And that's basic navigation of the Medical Home Portal, and that's the service that it provides. I will hand the presentation back over to Tammy. Thank you.
Thank you, Cassius. Next, Tasha Cadwallader will be giving an overview of the Sober Moms Healthy Babies website, how to navigate it, and how to find local treatment centers.
Hello, my name is Tasha Cadwallader, and I'm going to be giving you an overview of Sober Moms Healthy Babies. Sober Moms Healthy Babies is a site that can help providers and families find treatment and other services to reduce the impact of substance use in pregnancy. If you look at my screen here, I am on the sobermomshealthybabies.org page. This is the homepage that will come up as soon as you type in the search bar. The main thing I want to point out to you is the Get Help for Yourself option here in the middle of the screen. If we click on this button, it's going to take you to a page giving you an overview of how you can get help. The main thing here is towards the middle of your screen, the Click Here option, which is going to help you find a treatment center. It will bring you to this page where you can search by zip code or city. I'm just going to throw in a zip code here to show you an example. It will show you on the map different treatment centers in the area. And if you scroll down, it will list different treatment facilities, as well as provide a specific overview of how they operate, a link to their website, and contact information. I'm not going to go through each of these, but as you can see, there are plenty of options just from that zip code. As we go back to the home page, there's also the option for the Help Someone You Know. When you click on Help Someone You Know, it's going to also provide you information as far as how you can guide them to treatment and what kind of resources there are in your area. Same thing on this page, there is a Find Treatment Centers in Your Area link, which is going to take you to the page we just looked at. Going back to the Help Someone You Know tab, I do want to point out a few features, including some resources, which is the other huge part of Sober Moms Healthy Babies, alongside finding treatment. So if you click on the Health Professionals tab on the left-hand side, there are specific resources directed towards healthcare professionals, specifically focusing here on the top towards the CARA plan of care form. There are provider fact sheets, reporting guidance, and the form itself. As you scroll down, there are some updated resources on everything from tobacco use in pregnancy, alcohol use, and opiate use. If you click on substance use resources, these are more specifically focused towards the pregnant woman herself or family members instead of providers. Once again, on this page, there is a link focusing on finding treatment in your area, a phone number to the substance use helpline. Then there are some family information pages on the CARA plan of care. Keep scrolling and you will find more informational resources, similarly to the provider page, focusing on everything from tobacco use to marijuana, alcohol, opiates, etc. These resources are focused towards family members and pregnant people. That is the main information that the Sober Moms Healthy Babies website provides, finding treatment in your area, as well as different resources. Now, these are updated frequently. The links are updated with most current information, and the Find Treatment Center in Your Area search feature is updated as well. Thank you, and I'm going to direct back to Tammy.
Thank you, Tasha. Next, Ellie Comito, the Nevada Home Visiting Program Manager, will be giving an overview of what home visiting services can offer and where in Nevada those services can be accessed and how to make referrals to those agencies. And I will turn it over to Ellie.
Thank you so much. Again, my name is Ellie Comito. I am the program manager for Nevada Home Visiting. Nevada Home Visiting is a free and completely voluntary program funded through us by the Maternal, Infant, and Early Childhood Home Visiting grant through the Health Resources and Services Administration, or CARA, through the federal government. The aim of the program is to improve childhood and family outcomes by reducing and mitigating the impacts of poverty, substance use, and other risk factors. So we do this by providing coaching and positive parenting advice, as well as case management and referral to resources, screenings for things like developmental delays, intimate partner violence, and other factors that could be a risk for adverse outcomes with children and the family at large. We serve several counties throughout the state of Nevada, using evidence-based models, including Parents as Teachers, which serves children age 0 through 5. So you can enroll in Parents as Teachers as early as when you find out you're pregnant, up through age 5. Early Head Start, which is similar to Parents as Teachers. They use the same curriculum, but they are actually a home-based option of the larger center-based Early Head Start program. They also serve families with children age 0 through 5. Then, of course, we have home instruction for parents of preschool youngsters, affectionately called HIPPY. This program serves families with children age 3 through kindergarten. In some counties, which I'll get to later, they serve 2 through kindergarten. And then finally, we have Nurse Family Partnership. Nurse Family Partnership serves families who are first-time parents and are less than 28 weeks pregnant at enrollment, up through when the child turns 2. So if you are trying to make a referral to any of these programs, you're going to want to visit our website. We're here at dpbh.nv.gov. You'll search for Nevada Home Visiting. It'll take you here. It'll give you a little bit of a rundown. So if you're ever trying to kind of explain the program to a client, this is a really great resource to be able to do that more effectively. For referrals, you're going to go over to the right underneath resources, click on the providers link, and it will take you over to our list of all of the providers that we work with in Nevada. Important to note, there are dozens of evidence-based home visiting models funded through McVie nationwide. We fund these 4 models through 7 different agencies, and many of these agencies also operate other programs and other home visiting programs. So even if you try and contact this agency and they don't necessarily have room in that home visiting program at that time, they may be able to connect you and do that nice warm handoff to another program within their agency that is also an evidence-based model. These are just the ones that we fund. So starting in Clark County, we have Southern Nevada Health District. They operate Nurse Family Partnership. If you scroll down after the description here, you'll find their contact information, where their office is located, and easy ways to get in touch with them. Also in Clark County, as well as Nye County, we have Sunrise Children's Foundation. They operate both Early Head Start and HIPPY. So again, Early Head Start is 0 through 5, HIPPY is 3 to 5, or in Nye County, or in Clark County, they operate and serve as young as 2 through 5. And again, contact information is at the bottom. So you can always call ahead before making that referral and find out if they have room in their caseload for a new family. Up here in Washoe County, we've got University of Nevada, Reno. They operate Early Head Start, so 0 through 5, and they serve Washoe County. Here is their contact information, phone, fax, and you also have like a link to their site as well. Yarrington Paiute Tribe operates in Lyon County, serving specifically tribal families. They work with the Parents as Teachers model, so that's 0 through 5. Their contact information is all here. Lyon County Human Services serves the entirety of Lyon County. So the really great thing is that even though that area is massive, we have many programs that serve that county, so you do have some options. Kind of based on who your family is, where they live, what age their child is. They operate Parents as Teachers here. So again, 0 through 5, and all of their contact information is here. Moving back up to Washoe County, we have the Children's Cabinet, who operates HIPPY, so 3 through 5. and parents as teachers, 0 through 5. They have their main office on Sinclair Street in Reno. They also operate in Elko. So if you have families up in Elko, you can refer to Children's Cabinet. We just don't fund their operation up in Elko. We only work with their Washoe County office. And then finally, we have Community Chest, who serves in several different counties, including Carson City, Lyon County, Story County, Douglas County, and Mineral County. Those are the ones that we work with. They do serve other counties as well, using the parents as teachers home visiting model. But we only work specifically with those counties. So you can always reach out to Michael Ann Lazarino. He oversees the entire home visiting program within Community Chest, and she can give you a good referral to even if it's not with Community Chest, she can usually get you a good referral for how to get that family connected to services. They also have a ton of wraparound services that they include. They're kind of a one-stop shop agency. So a lot of these agencies, even if they are unable to engage the family in home visiting right away, if there's a waiting list, they usually have something else that's fitting and useful as a way to engage that family while they're waiting to get home visiting services. There are dozens of different ways you can qualify for home visiting, but most notably, having some sort of current or past interaction with substance abuse is one of the eligibility criteria that can qualify a family for home visiting services. Other eligibility criteria include being low income or having low income, active or veteran military service, developmental delays, intimate partner violence, either past or present, as well as learning disabilities and several other criteria. It's pretty easy to get a family into home visiting if there is a need. So that is pretty much the gist of this program. It's really awesome. We encourage you to check it out if you have a family that you think might qualify. Thank you so much, and I will turn it back to Tammy.
Okay, thank you very much. That concludes our presentation. On your screen, there are links to each of our program's websites. There is a staff listing on the right-hand side of each of the websites. Please feel free to contact us if you have any questions. We can also offer you promotional items that you can hand out to the families that you're working with. The promotional items can ship to you free of charge. They usually have a QR code or website on them, so families can easily find the websites such as Sober Moms, Healthy Babies, and Nevada Medical Home Portal. So please feel free to reach out for any items or questions, and thank you.